Hi friends, welcome to the channel Dinners. Here we are discussing about second part of Kerala PSC Staff Nurse exam conducted on 2014, and we already discussed yesterday first part. There around 33 questions we discussed there, 33 nursing questions. So here I am including rest of 32 questions. So there were 100 questions. Apart from 100 questions, 35 questions were general knowledge. So and 65 questions were from nursing topic. So in this 65 topic, first part we already discussed 33 questions. Now we are discussing next 32 questions. So yesterday you people are given a very good support. So today also please come and join with me. If you are not subscribe to my channel, please subscribe, don't forget it. So can we start? Kerala PSC Staff Nurse Previous Solved Questions Part 2. So Part 2, first question we will discuss. Before that, Unacademy IIT JAM provides a revision of biotechnology course, that is for IIT JAM preparation. So revision of biotechnology in this course, a fast track revision for IIT JAM biotechnology topic. The classes are conducted by toppers of the previous examinations. Madam Meenakshi Rajput, Vasudha Kotia, Chaprala Chandrasekhar, Avantika Bansal, Manisha Pallavi. You can check their profiles. They are toppers. Meenakshi Rajput is gold medalist in microbiology and 2 times CSIR net examination rank holder, and same Vasudha Kote also. You can check their profiles. So it will be a good opportunity for you to attend upcoming IIT JAM examinations. It is scheduled on February. So you have around 60 days for preparing this IIT JAM. So in this class, these top educators I already told: Madam Meenakshi Rajput, Vasudha Kotia, Chaprala Chandrasekhar, Avantika Bansal, Manisha Pallavi. They are taking classes that you can revise syllabus of biotechnology. Next is in this class, the course will include strategy, tips and tricks, practice questions, and time management technique for IIT JAM. So it will be very helpful for you how to prepare for the examinations. You will get an idea what are the questions, the pattern of questions, and how to manage time. There is a chance of getting short of time, so you need to manage the time. So how to manage it, this also will discuss in this course, and some tricks and tips and tricks to shortcuts and all. You will get an idea and you can make the correct answers. And in this course, the course will be in Hindi, and you will get the notes or the class notes in English. So it will be helpful for you, and I will give you a link in description box. You can check it there. You can check all the details, and you can check the educator's profile. Everything is there. So it will be a best opportunity for you to prepare IIT JAM. So we'll go to our topic, that is Kerala PSC Staff Nurse exam previous questions, solved previous questions, that is conducted on 2014. Yesterday we discussed 33 question. Now we are going 34th question. So shall we start? Hi everybody, good evening. Caesar, Thomas, Asha, Anish, Asha. Hi, good evening. Daisy, Liju, Jeena, Sunil, Arun Rathod. Regarding Karnataka PSC, I will let you know. Right now, I don't have any information regarding Karnataka PSC exam. Good evening, Bisma Jan, Dharmendra Rangi. So, shall we start? So, first question. A patient can become toxic on a normal dose of digitalis when dash is present. Options: hyperkalemia, hypertension, hypokalemia, hypotension. Options, please. Answers, please. Manish Bhagya, hi. Bisma Jan, Elizabeth Jose, your options are noted. Divya Shibu, Arun Rathod will discuss Karnataka PSC also. So this is Kerala PSC questions. After that, we can discuss Karnataka PSC questions also. Caesar Thomas, okay, I will give you a right answer. It is not hyperkalemia, it is hypokalemia. The questions you just read once again. A patient can become toxic on a normal dose of digitalis when dash is present. What is the main side effect of digitalis? That we need to check. Because digitalis will cause hypocalcemia as a side effect. If patient is already have hypokalemia, it will leads to a fatal effect to the patient. So correct answer is hypokalemia. Digitalis side effect is, it is one of the side effect is hypokalemia. If patient is already having hypokalemia, if we are giving normal dose again digitalis, it will further deteriorate the condition. That is hypokalemia will increases, the potassium level will become low, very low, and it will leads to death of the patient. It will lead to arrhythmia and death of the patient. That is a last result. Signs and symptoms of digitalis. Anybody knows? Signs and symptoms includes halo visions, arrhythmias, arrhythmia mainly bradycardia in digital toxicity, and nausea, vomiting. These are the main side effects of digitalis. Hypokalemia is one of the main side effect, and you should not give digitalis medicine when the patient's heart rate that is below 60. If it is below 60, you should not give digitalis. Next question. If the activities done by the pupil are repeated by a patient, it is called. Second question. If the activities done by the people are repeated by a patient, it is called echolalia, hyperactivity, compulsion, echopraxia. Thirty-fifth question answer. Arun Rathod, your answer noted. Caesar Thomas, your answer noted. Any other answers? Soumya Monish. So I think your answers are. Any other options? Okay. Some of you given option A, right answer. Some of you given option D, right answer, and one of you given option B. So correct answer is, yeah, correct, Ashok Panwar. Those who are given option D, echopraxia is correct answer, because activities, echopraxia, so that means activities. It is related to activities. Echolalia means spoken words. Echolalia means repetition of spoken words. Echopraxia means repetition of activities. That is the main difference between echolalia and echopraxia. And what is hyperactivity? Hyperactivity means increased movement. Increased movement of a person that is not required for that particular situations. That is what hyperactivity. Compulsion means due to the repeated thoughts, a person is very restless to act. Because of the restless thoughts and patient, the person make actions because of that compulsive actions. So that is about the second question. Option correct answer is echopraxia. I already told. Next question. The most important cause of diarrhea in infants and children. Easy question. The most important cause in diarrhea in infants and children. 36th question. Arun Rathod, your answer noted. Jasila, Caesar Thomas, Arun Rathod, Bisma Jan, Suraj Singh, Soumya Monish. Any other, apart from any other option? So most of you given B, option B correct answer. That is correct only. The most important cause of diarrhea in infants and children is rotavirus. Rotavirus infection, that is most common in children. The main symptom of rotavirus infection is severe diarrhea, then vomiting, abdominal pain, gastroenteritis. These are the main symptoms of rotavirus infection. If it is not treated, the baby will die due to hypovolemia or dehydration. Because of severe diarrhea and vomiting, the dehydration will occur and it will leads to hypovolemia and eventually death. And salmonella will cause typhoid. Salmonella typhoid. Vibrio cholerae causes cholera. E. coli is common. It will commonly causes UTI. So next question, 37th question. 37th question, okay. Normal PR interval in ECG. Normal PR interval in ECG. 0.20, 0.35 second, 0.30 to 0.45 second, 0.35 to 0.40 second, 0.12 to 0.20 second. Normal PR interval. So these questions we already discussed in ECG question and answers. So if you are remembering that answer, you can give it here. So most of you given options and only. Okay, any other options? Bisma Jan, Soumya, Monish, Manjusha Matthew, Naina Sedan, Arun Rathod, Mugesha Rajoria. So correct answer is option D, that is 0.12 to 0.20. The normal PR interval is 0.12 to 0.20. Normal QRS interval is 0.08 to 0.10. PR interval is 0.12 to 0.20. QRS complex, that is QRS interval is 0.08 to 0.10. Next question, easy question. Antidote question. In antidote, we should study around 20 to 25 questions only. So you can easily get 2 or 3 questions in every exams. Apart from Kerala PSC, in AIMS, NIMANS, everywhere, one of the antidote question will be there. So you should thorough with the antidote question. So here, the antidote of warfarin. Heparin, vitamin K, vitamin B12, iron. Okay. I think it is easy question. Correct answer is vitamin K. Antidote of warfarin is vitamin K. Antidote of heparin is protamine sulfate. Antidote of iron toxicity, that is deferoxamine. Okay, these are the common questions. You should thorough with the antidote questions because you can easily score 2 or 3 marks. Next question. What is a normal CSF pressure when the individual is lying on his side? 39th question. What is a normal CSF pressure when the individual is lying on his side? 15 centimeter of water, 20 centimeter of water, 10 centimeter of water, 25 centimeter of water. So I think you all are giving correct answer. So the correct answer is 10 centimeter of water. Lying on his side, or lying on his supine position, or lying in prone position, it will not change the CSF, because one important thing is the head should be in neutral position. If it is bent, means it will cause a increase in CSF. Otherwise, head is in a neutral position, that means the CSF will be in normal only, in supine, lying or prone position. Correct answer is 10 centimeter of water. Next question. Immunization of DPT should be administered by. Immunization question also important. So you need to thorough with the immunization, universal immunization schedule, and the vaccines route, dose. These are the and storage. These are the important questions asked related to immunization. So options: intradermal, intramuscular, subcutaneous, intravenous. DPT vaccine, route of DPT vaccine. Okay, I think most of you are given right answer only. That is option B, intramuscular. DPT route of DPT vaccine is intramuscular. Usually it is given vastus lateralis muscles, and other intramuscular vaccines includes DT, that is diphtheria vaccine, TT tetanus vaccine, and IPV polio vaccine, and Hib vaccine, influenza vaccines. These are the vaccines given through intramuscular. Intramuscular vaccines include DPT, DT, TT. TT means tetanus toxoid, DT means diphtheria toxoid, and Hib vaccine, influenza vaccine. These are the vaccines given through intramuscularly. And intradermal vaccine example is BCG. BCG vaccine is given through intradermal. And subcutaneous vaccine examples include measles, MMR, yellow fever. These are the vaccines given through subcutaneous route. Intravenous, there is no vaccines given through intravenous route. And oral vaccines includes first one is OPV, that is common vaccines, and second one is rotavirus vaccines. These two vaccines administered through oral route. So I think you are clear with the vaccine common vaccines and their route. Next question. Pentavalent IM, correct? Pentavalent contains this DPT, Hib, everything. So that is also IM. So next question, 41th question. Which among the following drug is used in the treatment of alcohol dependence? Options: disulfiram, lithium, carbamazepine, verapamil. Any other options apart from option A? So most of you given option A. That is right answer. Good work. Keep it up. So what is the dose of disulfiram? Anyone know what is the dose of disulfiram in alcohol dependence? Usually disulfiram 500 mg OD. 500 mg OD dose initially we will start. That may be for 1 week or 2 weeks. Disulfiram 500 mg initially we will start for 1 week or 2 weeks. It usually given at morning time, and next after the first course as a maintenance dose we will give 250 mg of disulfiram. First 1 week or 2 weeks we will give 500 mg of disulfiram, and after that we will reduce the dose to 250 mg and we will keep it there, and that is a maintenance dose. So what are the symptoms if patients taken the alcohol? after disulfiram dose. That includes facial flushness, vomiting, muscle cramp, and in some conditions, uh, uh, nausea and vomiting, and blurred vision, breathing difficulty. These are the common effects if patients taken alcohol after disulfiram injection, after disulfiram treatment. The effect will be that effect of disulfiram will be for 14 days. If the person's taken alcohol during that time, the patient experience these signs: flushing, facial flushing, nausea, vomiting, breathing difficulty. These are the main symptoms of alcohol after the disulfiram treatment. The action of disulfiram means it will inhibit the action of the enzymes acetaldehyde dehydrogenase. The disulfiram inhibits the action of acetaldehyde dehydrogenase enzymes. That is the main enzymes that converts the alcohol in our body. So it will inhibit that enzymes actions. So it will leads to these symptoms, facial flushness and these extreme symptoms. For alcohol intoxication, in the case of alcohol intoxication, for we will use diazepam also. Acute intoxication, we will use diazepam. That is another thing. Next question: insertion of needle in the pleural cavity is known as. Insertion of a needle into the pleural cavity is known as endoscopy, paracentesis, thoracentesis, evisceration. Naina Sadan, Ashok Kumar Hanspur, Liji Jayesh, Sanila, Jasveer, Dharmendra Rangi, Manish Bhagya, Shilpa Matthew, Bisma, Merin, Sherry, Ramawat. So most of you given option C, that is thoracentesis. That is correct answer only. Insertion of a needle into the pleural cavity is known as thoracentesis. Endoscopy means visualization, that is a general term, visualization of a hollow cavity, that is known as endoscopy with the help of endoscope. Visualization of a hollow organ with the help of endoscopy is known as endoscopy. Paracentesis means insertion of a needle into the abdominal cavity. Paracentesis, usually abdominal paracentesis, it will tell. Paracentesis means it is a insertion of needle into the abdominal cavity. Thoracentesis means insertion of needle into pleural cavity. Evisceration means the edge, separation of the wound edges and the internal organ will come out. That condition is known as evisceration. Separation of wound edges and internal organs coming through that wound edges is known as evisceration. Next question: lack of oxygen in bloodstream is known as. Lack of oxygen, 43 question. Yes, Ashok Panwar, in ascites, liver cirrhosis condition, there will be ascites. For tapping of the fluid, we will use abdominal paracentesis. Next question, 43, lack of oxygen in the bloodstream. Options: apnea, cyanosis, anoxia, anoxemia. It is a tricky question, confusing options are there. So please read questions and give your right answer. Lack of oxygen in the bloodstream. Important thing is bloodstream. So there are different options. So we will check the correct answer. The correct answer is anoxemia. Anoxemia is known as lack of oxygen in the bloodstream. Anoxemia. Ischemia means that is related to bloodstream. Apnea means absence of breath. Cyanosis means bluish discoloration. Anoxia means lack of oxygen supply. that is zero oxygen supply, that is known as anoxia. And hypoxia means low oxygen supply, that is hypoxia. Anoxia means zero, lack of oxygen supply. Anoxia means lack of oxygen in bloodstream. Hypoxemia means low oxygen in the bloodstream. Hypo and anoxia, that is difference. Means hypo means there is low amount is very low. Anoxemia means there is no oxygen, lack of oxygen. That is a difference. Hypo and anoxemia. Hypoxemia and anoxemia. Next question. Fracture occurs at the distal end of the fibula. Fracture occur at the distal end of the fibula. Colles fracture, oblique fracture, spiral fracture, Port's fracture. 44 correct answer, please. Jasveer, Mumtaz, Manju, Sheikh Sania, Anju Tomar, Manjusha Matthew, Lubna, Jasveer, Naina, Sherry, and C. So there are different options are there. Dharmendra Rangi given 3, D option. Ashok Kumar Hanspur 2, D option. Ashok Panwar, port fracture. Okay, we can check the right answer. The correct answer is port fracture. Fracture occur at the distal end of the fibula. That is Port's fracture. Then what is Colles fracture? What is Colles fracture? Anyone know Colles fracture? Ashok Panwar, you are right. Colles fracture means fracture of the distal end of the radius bones. That is Colles fracture. So don't confuse with the Colles fracture and Port's fracture. Some of you given option A. So that is why I cleared your doubt. Colles fracture means distal end of the radius. Port's fracture means distal end of the fibula. Next question. The most preferred intramuscular injection site for children. Easy question. The most preferred intramuscular injection site for children. Options: deltoid dorsogluteal, vastus lateralis, ventrogluteal. 45 answer. Okay, come on. So I can't read your name because it is coming very fast. Ashok Kumar Hanspur, he has given 5C option. Okay, most of you, nobody given wrong answer here. All are given option C, vastus lateralis. That is the correct answer. The most preferred intramuscular injection site for children is vastus lateralis because deltoid and dorsogluteal, ventrogluteal muscles are underdeveloped in that conditions. Vastus lateralis is preferred location for intramuscular injection site for children. Next question. Characteristic hormone of the placenta is. Characteristic hormone of the placenta is estrogen, chorionic gonadotropin, corticotropin, oxytocin. Question 46. Characteristic hormone of the placenta. I think this is also a easy question. So everyone given right answer, that is option B, chorionic gonadotropin. Characteristic hormone of the placenta is human chorionic gonadotropin or HCG. Next question. Positive Chostek's and Trousseau sign are early indications of. Positive Chostek's and Trousseau signs are early indication of rickets, Addison's disease, tetany, Cushing syndrome. 47 question. This is a little difficult question, I think. There are different options coming from you. Okay. So Most of you given option C. Correct. So correct answer is option C, tetany. Then can you explain what is Chostek sign or what is Trousseau sign? It is occurs due to hypocalcemia. Then what is positive Chostek sign means? Can you explain? Anyone? Abhinay, carpopedal spasm. Which one? Positive Chostek's or Trousseau sign? Okay, I will tell. Chostek sign means that is facial muscle spasm. When tapping the facial muscle will be spasmodic. That is the condition. That is a positive Chostek sign. Where when tapping the facial muscle here, the facial muscle will be spasmodic. That is positive Chostek sign. Trousseau sign means when we are inflating BP cuff when we are inflating BP cuff, there will be carpospedal spasm. That is positive trousseau spine. Both of the condition are seen with hypocalcemia. That is with tetany. So that is about Chostek's and trousseau sign. I think it is clear. Any doubt? Yes. While inflating BP cuff, Ligijesh, you are correct. When inflating BP cuff, there will be a carpospedal spasm. That is a positive trousseau sign. When tapping the facial nerve, there will be facial muscle spasm. That is positive Chostek sign. Both are due to hypocalcemia. Next question, 48. Sudden return to normal temperature from a very high temperature within a few hours. Options: crisis, lysis, remittent fever, continuous fever. Question 48. 48. Steffi Matthew given B. Manju Hari A. Abin A. Crisis. Dhyan Lal option A. Mumtaz Bina A. Lubna Abdul Kalam A. So now all are giving option A. So we will check the correct answer. The correct answer is crisis. Sudden return to normal temperature from a very high temperature, that is within a few hours, that is known as crisis. Then what is lysis? Crisis is sudden return. What is lysis? Second option. Lysis means gradual return. Gradual return from high temperature to normal temperature is known as lysis. That is typical pattern. And what is remittent fever? Remittent fever. Remittent fever means there will be a temperature change, that is more than 1 degree Celsius. There will be a temperature changes from the different situation, that is within 24 hours, more than 1 degree Celsius, but it is not reaching to normal. The temperature changes within 24 hours more than 1 degree Celsius, and it will not reach as normal. In that kind of fever is known as remittent fever. Remittent fever, temperature changes 1 degree Celsius within 24 hours, but it is not reaching to normal. And continuous fever means that is constant, the same temperature, the high grade temperature will be remain same for a longer time. That is known as continuous fever. And one more fever is there, intermittent fever. Intermittent fever means in that conditions, for a period of time there will be fever, and then the patient become normal later. For a period of time, patient will be febrile, then patient will come to normal temperature. Then again later, again we'll go to febrile stage. That kind of fever is known as intermittent fever. So intermittent fever is characteristic feature of malaria. Remittent fever is seen in typhoid fever. Intermittent fever is seen in malaria. Next question. Which of the following symptom is most commonly associated with vitamin C deficiency? Which of the following symptom is most commonly associated with vitamin C deficiency? Photophobia, bleeding gums, muscular hypoxia, conjunctival cirrhosis. So your options all are given B. So we'll check the right answer. So right answer is bleeding gums. Vitamin C deficiency will leads to scurvy. One of the main symptom of scurvy is bleeding gums. So in COVID time, vitamin C is given for boosting immunity, and that also we are seeing in this COVID time. And apart from that, main vitamin C function is healing, repair of tissues. These are the main functions of vitamin C. And in COVID time, it is given for as a immuno booster. Vitamin C 500 mg OD. Sometimes it is giving BD dose also. Next question. Which among the malarial parasite is responsible for cerebral malaria? It is a repeated question. Which among the malarial parasite is responsible for cerebral malaria? Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, Plasmodium quartan. 50. Question number 50. Answer please. Bismajan, Limsitab, correct. So malarial parasite is responsible for cerebral malaria is option C, that is Plasmodium falciparum. It is very common question, repeated question in most of the government exam. So you should learn this question by heart. That's all. Easy 1 mark question. Next question 51. One of the major cause of left-sided heart failure. One of the major cause of left-sided heart failure: septal defect, congenital heart disease, pulmonary valve stenosis, hypertension. 51 answers, please. It is, I think, confusing question. So you are giving answer in different options. D, A, C. So shall we check the correct answer? Okay, correct answer is option D, hypertension. Hypertension means the resistance of the blood vessels, arterial wall. That is a major cause of left-sided heart failure. Left-sided means left ventricular failure. That is common cause is hypertension. Okay. So it was a confusing question, I think. Next question. Secretion of parathyroid hormone is stimulated by. Secretion of parathyroid hormone is stimulated by hypokalemia, hypercalcemia, hyperkalemia, hypocalcemia. Secretion of parathyroid hormone. 52 answers, please. Adira Unni, Dhyanlal, Jija Thomas, Sophie Suk, Thinker Learners Platform, Lubna, Vidya, Sherry, Manjusha, Shafi. So there are different options. Parathyroid hormone is related to Sanila Matthew, Mumtaz, Manish, Bhagya, Tinkle, Salim, Siji, Veena, Sharath, Manisha. Okay, I noted your answer. We will check the correct answer. Correct answer is hypocalcemia. Parathyroid hormone is secretion of parathyroid hormone is stimulated by hypocalcemia. When blood calcium will be become low, that time stimulate parathyroid hormone secretion is increased, and parathyroid hormone helps to uh, absorption of calcium from the intestine, and also it will take calcium from the bones. So serum calcium level will be become normal. So parathyroid hormone helps absorption from the intestine, calcium absorption from the intestine, and also it takes calcium from bones. That is the main function of parathyroid hormone. It is stimulated by hypocalcemia condition, secretion of parathyroid hormone. Next 53 question, which of the following hormone is called stress hormone? Which of the following hormone is called stress hormone? Calcitonin, vasopressin, cortisol, prolactin. It is a tricky question actually. C, cortisol, B, A, option B, Ashok Kumar, B, Sheikh Saria, B, Preeti, C, Manjusha Matthew, C, Bisma, C, Jasveer, C. I think most of you given right answer only. That is correct answer is cortisol. Stress hormone means cortisol. In some stressful conditions, when body experience stressful conditions like infections or any injury, there will be production of increased production of stress hormone, that is cortisol. The brain will identify the situation, and brain will identify it is a stressful situation to the body. Then it stimulate the production of cortisol. Cortisol is produced by adrenal medulla. Cortisol is produced by adrenal medulla. So that is known as stress hormone. Next question, 53 question. Which meal plan is best for the patient with reactive hypoglycemia? You need to read question carefully. Which meal plan is best for the patient with reactive hypoglycemia? Because you should know about reactive hypoglycemia, then only you should answer. Avoidance of fats and proteins, small and frequent diet meals, low fiber and high carbohydrate diet, avoid fats, complex carbohydrate and proteins. So it is actually a very good question according to me. So reactive hypoglycemia, that is the key word in this question. So because of that, your answers also is different. Some of you given C options, some of you given B options, and D option also there. Small and frequent diet. Small and frequent diet is a correct answer in reactive hypoglycemia. The meal plan in reactive hypoglycemia is small and frequent diet. Then anybody can explain what is a reactive hypoglycemia? Reactive hypoglycemia means, anybody can type or comment. Okay, it is right answer is small and frequent diet, 53. So my question is, what is reactive hypoglycemia? Why small and frequent meals is given for reactive hypoglycemia? So I will explain this. So reactive hypoglycemia means after the meals, patient within 4 hours, patient will be hypoglycemic. After the meals, usually after 1 to 2 hours, the patient's glucose will be become normal. So in this reactive hypoglycemia, within 4 hours after meals, patient's glucose will be low. Reactive hypoglycemia, that is known as reactive hypoglycemia. Because the reason for that, after the meals, body will produce increased insulin level. more than the required insulin will produced by body. That will leads to reactive hypoglycemia. This is the first indication of diabetes mellitus. In some persons, reactive hypoglycemia is the first indication for diabetes mellitus. So I think it is clear for you, reactive hypoglycemia. Okay, Esther Saroni, sudden fall the sugar. Yes, exactly. Sudden fall the sugar within 3 to 4 hours after the meal. Low blood sugar after meals. Logesh Rao, you are correct. Liji Jayesh, you are correct. Midnight hypoglycemia. Okay, that is different, I think. Reactive hypoglycemia and midnight hypoglycemia. Is she pricey? Please check that one. And the next question, what is the recommended maximum noise level? Question from community health nursing. What is the recommended maximum noise level? 85 decibel, 90 decibel, 80 decibel, 75 decibel. Recommended noise level maximum. Option A, Steffi Matthew, Ishi Pricey D, Shaiju Anamula C, Shiju Anamala. Okay, you are giving fast answers. So I am waiting for your answers. All of you, please give your answers, please. Fast. The max. So I think it is over. Low blood sugar after meal within 2 to 4 hours. Ajish Sagarji, you are correct. Previous question answer. Okay, most of you given option A. That is right answer. Very nice work. 85 decibel. That is the maximum noise level recommended. Recommended maximum noise level, that is 85 decibel. Next question, angiotensin 2. Angiotensin 2 increases which of the following? RAA mechanism, renin, angiotensin, aldosterone mechanism. Angiotensin 2 increases which of the following? Vasodilation and ADH secretion, vasoconstriction and aldosterone secretion, venous flow from the extremity, arterial flow to the extremity. So I think we need to make a little faster here. Already 10:20. Angiotensin 2. Okay, we'll go to correct answer. That is vasoconstriction and aldosterone secretion. Angiotensin 2. So what I will explain about what is the RAA mechanism, renin, angiotensin, aldosterone mechanism. So in the when the blood circulation to the kidney glomerulus become low, then kidney identifies that and produces renin. Renin will be produced by kidney when the kidney blood flow become low. So renin converts angiotensinogen. Angiotensinogen is produced by liver. This angiotensinogen is converted into angiotensin 1. Angiotensin 1 become angiotensin 2 with the help of angiotensin converting enzymes, that is ACE. ACE enzyme converts angiotensin 1 to angiotensin 2. This angiotensin 2, it will help to increase vasoconstriction and aldosterone secretions. In vasoconstriction and aldosterone secretion, aldosterone helps to get fluid from the kidney, and it will make fluid collection from kidney, and vasoconstriction will leads to hypertension tension. So this mechanism will increase the blood flow to the kidney. That is a renin angiotensin aldosterone mechanism. Renin converts angiotensinogen produced from liver. That angiotensinogen is converted to angiotensin 1 by renin. This angiotensin 1 will be converted to angiotensin 2 by angiotensin converting enzyme or ACE. This angiotensin 2, it helps to increases the product. Angiotensin 2 increases vasoconstriction and aldosterone secretion. I think it is clear. Next question. The cells involved in inflammatory reactions are called. So we will make a little faster here. The cells involved in inflammatory reactions: neutrophils, eosinophils, basophils, lymphocytes. Options please. Answers please. We'll make little faster. Please make your answer. The cells involved in inflammatory reactions. Option D, C, D. So I think it is difficult for you, or it is making confusion for you, because different options are coming from you. So I will go to correct answer. The correct answer is basophils. The cells involved in inflammatory reactions, that is basophils. In infections, neutrophils is the first WBC cells that reacts against infections. Eosinophils rate, that is increased in allergic conditions. Allergic condition is one of the main reason for increasing eosinophils count, and also it is increased in some cancer, some type of cancers. And lymphocytes is usually that is also increased in the virus or bacterial infection. Neutrophils exclusively for bacterial infections. Eosinophils increased in allergic and some kind of cancers. Basophils in inflammatory conditions. Lymphocytes, that is usually increased in chronic bacterial or viral infections. Next question. Muscle covers the shoulder and back of the neck. Muscle covers the shoulders and back of the neck. Options: trapezius, masseter, biceps, temporalis. Correct answer is trapezius. Trapezius muscles cover posterior part of the neck and shoulder. And masseter muscle is seen in lower jaw part. This is angle of the jaw. There is a position, location of masseter muscle. It helps the movement of jaw and mastication. Masseter helps for mastication. Biceps, it is seen in upper arm. And temporalis muscle is seen over the temporal bone. And it will go to in front of the ear. And temporalis muscle also helps for mastication. Next question. In which part of the brain respiratory center is located? Easy question. Cerebral cortex, hypothalamus, midbrain, medulla oblongata. 58 question. Answers please. We'll make little faster here. 58 answers. Satyapriya, Nasiba, Manjuhari, Liji, Lubna, Alfonsa, Gurneet, Josmi, Merin Matthew, Rija, Bisma, then Dhyanlal, Sophie, Jasveer, Nimisha, Manjusha, Idesh, Aradhi, Lokesh, Archana, Adira, Monisha, Mohan, Saranya. Okay, I will give a correct answer. Correct answer is medulla oblongata. It is an easy question. Most of the vital functions are controlled by medulla oblongata. That is cardiovascular and respiratory functions are controlled by medulla oblongata. Common questions, repeated questions. Next question. What is a common complication of varicocele? What is a common complication of varicocele? Phimosis, erectile dysfunction, infertility, cancers. Varicocele complication. 59 answers please. 59 answers. Phimosis, erectile dysfunction, infertility, cancers. Preeti Jose, Logesh Rao, Liji Jayesh, Lovely Thomas, Sanila Matthew, Lubna, Nimisha, Gurneet, Shyamala, Mukesh, Ashok Kumar, Shafi Matthew, Josmi, Archana, Priya Devu, Manjusha, Satyapriya, Jija Thomas, Sherry M, Arathi Sunil Kumar, Minu, Pariror, Manju. Okay, correct answer is infertility. Most common complication of varicocele is infertility, that is in male. Male infertility, one of the cause is varicocele. Next question, which among the following condition come under cyanotic heart disease? Ventricular septal defect, arterial septal defect, tetralogy of Fallot, patent ductus arteriosus. 60 question answers. Cyanotic heart disease. Example. Anju Tomar, please read once again the question. It is cyanotic heart disease. Example. Naina Sadan, you need to read question once again. Okay, correct answer is tetralogy of Fallot. Example of cyanotic disease is tetralogy of Fallot. We will go to next question. The most common site of bleeding in children with hemophilia. Common site of bleeding in children with hemophilia. Options: joints, stomach, gum, nose. 61 question. Common site of bleeding in children with hemophilia. So I think this is also confusing. Options are different from you. C, A, D. So all are giving different options. I think correct answer is joints. The common site of bleeding in children with hemophilia is joints. That is most common site is elbow and knee. Elbow is the most common site. Next 63 question. A client receiving morphine sulfate should be observed for. Repeated question. Morphine sulfate question is common. Options: respiratory depression, blood dyscrasias, gastritis, jaundice. 63 answers please. I think everyone familiar with this question. All are given option A. So we will go to our correct answer. That is correct answer, respiratory depression. So after giving morphine sulfate, we should watch for the respiratory rate, respiratory pattern of the breathing, that is chest movement, and oxygen saturation. So if any changes in respiratory pattern, or that is chest movement, or breathing rate, that is bradypnea will be there, and oxygen saturation also will go down in respiratory depression. Next question. Bleeding due to the premature separation of a normally situated placenta is known as, or is called. Bleeding due to premature separation of normally situated placenta. Normally situated placenta. Placenta previa, incidental hemorrhage, postpartum hemorrhage, abruptio placentae. 64 question. 64 question. 64, yes, Dhyan Lal given option D, Manju Hari option A, Liji. I think you are given, most of you given answers. Pariror, you should read the question once again. Normally situated placenta. If placenta is normally situated, option A will not be the correct answer. Okay, correct answer is abruptio placenta. Abruptio placenta means premature separation of the placenta, normally situated placenta. Why it is, I am telling normally situated placenta means, in placenta previa, the placenta will be located at the lower segment of the uterus. Lower segment of the uterus. When it, according to the location, it is classified into first degree, second degree, third degree, fourth degree. Because if it is closing the internal os, that means completely closing the internal os means that is a fourth degree. Fourth degree placenta previa. It is not closing the placenta previa and located in the lower segment means that is a first degree placenta previa. So that is why I told repeatedly normally situated placenta. In placenta is normally situated means that is not a case of placenta previa. Placenta previa, the location of the placenta is abnormal, that is lower segment. In the another difference between placenta previa and abruptio placenta, in placenta previa the bleeding will be painless. Placenta previa the bleeding will be painless. In abruptio placenta it is a painful bleeding. Next question. Bagasosis is caused by inhalation of 65 question. Bagasosis is caused by the inhalation of. It is an example of occupational disease. Options: sugarcane dust, cotton dust, coal dust, silica dust. "65 question answers. Okay, our time is over around 10:33 now. So correct answer is sugarcane dust. Bagasosis means inhalation of sugarcane dust. It is an example of occupational disease. There are 5 or 6 occupational diseases are there. So you should thorough with the occupational disease. One of the question is very common. So cotton dust means bicyanosis. Inhalation of cotton dust means it is known as it will leads to bicyanosis. Coal dust, inhalation of coal dust means it will leads to anthracosis, and silica dust inhalation leads to silicosis. Okay. So our questions completed. 65 questions asked from nursing topic in Kerala PSC staff nurse exam 2014. So tomorrow or next questions we are discussing around NER, the Northeastern Indira Gandhi Institute practice questions. So please join with that time. We will discuss there in detail. So thank you for joining with me, and it is a nice experience, and most of you given participated very actively, and please support in future also. Good night. Thank you. Aradi, Liji, Anu, Dhyanlal, Minu, Lubna, Sanla, Archana, Elizabeth, Pariror, Bisma. If it is helpful means please like and share. Don't forget it, and you can share with your friends and make them subscribe. So because of your support only we can do more videos. So today I already given. We are next week we are making around 6 videos. Today we made second part of the Kerala PSC exam, and next NERGM previous questions or practice questions, and then we will make nursing education questions video, and then neurology questions video, then OBG, then within that time second stage of AIMS some notification will come, or otherwise I am preparing that seat allocation patterns, that is how much seat will be allocated for undeserved category, OBC, SC, ST, EWS and all. But it is difficult because we don't know how many males and females are there in rank list. So that is a bit difficult. That is why I am not making now. So good night. See you tomorrow.